Just ahead on American Black Journal, nearly 7,000 medical professionals will be in Detroit for a convention focusing on the health of minorities. We'll tell you about the conference and its importance to African Americans. Plus, we'll talk about the need for mental health awareness in the Black community. And we'll get a look at the state's new adventure center that encourages kids to get active outdoors. We've got a lot of information for you, so stay right there. American Black Journal starts now.
At DTE Energy, we believe that we have a greater responsibility. We believe that being part of a community means being involved in the fabric of that community, investing time, effort, and resources in the communities we serve. DTE Energy Foundation is a proud sponsor of American Black Journal.
Welcome to American Black Journal. I'm Stephen Henderson. For the first time in more than 30 years, the oldest and largest professional organization that represents African American doctors is going to hold its annual convention in Detroit. The National Medical Association will gather at Cobo Center from August 1st through the 5th for a conference and scientific assembly that promises to make history. A special summit on the health of minorities will feature the current Surgeon General of the United States along with 5 past Surgeons General. Plus, there will be scientific workshops focusing on the impact of various diseases on African Americans. Here to tell us more is the Speaker of the House for the National Medical Association, Dr. Lonnie Joe. You may also recognize Dr. Joe as the host of Primary Care, a program that's seen here on Detroit Public Television. Welcome to American Black Journal.
Thank you, Stephen. Thanks for having me.
7,000 African American medical professionals all coming to Detroit. That's pretty exciting.
We're hoping to hit that number. Yes.
Yeah, that's a big deal.
A big deal.
So tell me about the symposium that's going to take place about minority health. What are people likely to learn from this?
Absolutely. As you stated in your introduction, the National Medical Association was founded in 1895. Now, that was a time when Black doctors could not join the American Medical Association,
right?
So they developed their own. And all these years later, we're still striving and going forward, representing the patients that we take care of, which in essence is representing all patients, and in particular the healthcare professionals that service them.
Yeah.
And during these years, we have been champions of lots of things in healthcare. We spoke for and lobbied for, back in the early 60s, for Medicare. By the way, this is the 50th year anniversary of Medicare.
This is the 50th anniversary of Medicare,
And we'll be celebrating that during this convention at Cobo Hall also. But everybody else in this country said no to Medicare. And it was the American Medical Association who had the strongest lobby.
Yeah.
But at the time, Lyndon Johnson being president carried this forward. And it was the National Medical Association that actually stood up for what is probably, or was, the greatest piece of legislation in this country that benefits patients until the Affordable Care Act recently.
Sure.
So we've been fighting this battle for a long time and continue to address the issues that affect minorities in particular.
Yeah. When you talk about healthcare and African Americans, I always feel like there's two sort of columns, pillars that you're dealing with. One is access, the other is health itself. And in both cases, that's very different than it is for the majority population.
Absolutely. When we have studies that have actually shown that African Americans can start at the same place and end up at a different place simply because of the access issue and the social issues around healthcare, it means that we're doing something wrong in this tremendous business, this explosive business called healthcare. And that's part of what the NMA, the National Medical Association, addressed with some of its efforts in terms of making sure that people know what time it is in this healthcare arena.
Right, right. When you talk about health, obviously the diseases that contribute to shorter lifespans for African Americans continue to sort of confound us in terms of how to deal with them. The access is one thing, but then it's a question of how do you combat those things still?
Absolutely. Access coupled with actual treatment, the availability of health providers to see patients and actually make decisions that give us different outcomes is the formula that works. And that's why an organization like the National Medical Association is so important, because when we do things that help patients, it really lifts all boats. It may sound like it's an African-American focus, but it's hard to talk about the treatment of diabetes, which is the #1 growing disease that we have in this country, and how we affect change in the African-American community, and it doesn't translate to the rest of the community in this country.
You've got
it's a no-brainer.
That problem with kids everywhere now.
Yes, and
right?
the obesity issue. The kids are fatter than they've ever been. They're less active than they've ever been. That equals diabetes at an early age, which is a totally avoidable disease, or preventable disease if we approach it properly.
Yeah. Tell me a little more about the conference. It's 4 or 5 days in August. What goes on at a conference of doctors?
Well, first of all, there will be over 700 lectures given during the 5-day period for the conference, the lectures and presentations. And this is done on purpose because we try to address as much as we can during this conference. We have 24 different sections in the National Medical Association, and everything from aerospace to women's medicine will be addressed, with emphasis on what we're dealing with most recently, and that is the Affordable Care Act. This year we've decided to highlight this in a manner of inviting the current Surgeon General, Dr. Murthy. He will be here, as well as the last 5 Surgeon Generals. We did this as a sort of a review of this historic legislation because, first of all, it's the first time we've really been able to have a significant healthcare discussion at this level in this country.
Right.
And there's a lot of confusion around it. And our job as providers, to some degree, is to help resolve some of that confusion. So we're going to be addressing how this act has affected patients, hospitals, insurance companies, providers. We're going to bring out a lot of the details. It needs a lot of work on it, and I think we're up to the challenge.
Yeah, so in your estimation, I mean, one of the things I think is true that we don't talk a lot about is the profoundly different effect of the Affordable Care Act on African-American community than others in terms of just in terms of access. I mean, you are insuring far more African-Americans through that than we were before. But when you say it needs work, what is it that you're thinking about?
Well, I think what we're dealing with right now, I know what we're dealing with right now in this form of legislation, is what they could get through the House and the Senate at the initial point of inflection of this administration.
Right. It's a product of compromise.
Absolutely. The way that this started out originally and what we have now is something totally different. Like most sausage
like
making.
Most legislation.
Okay? Right. And what our job is to, at this point now, continue to move in the direction it has created and to make it better every step of the way. It's like a big ocean liner. It's not going to turn on a dime. It's going to take a nice long time to swing and get to where we want it to be. But if you look at how it has been rolled out and the response to it and the timing that has been set forth for it to reach its goals, we still need a little more time to make this right. In particularly as the American population gets older and continues to draw on the healthcare dollar, we are probably late in getting started. The initial approach to this was under the Clinton administration with the Hillary Care, and that was 20 years ago.
It took us a long time to fight to get anything passed.
Absolutely. So as it is, the powers that be decided that this was the best that they could do, and it's our job now to make it even better.
Yeah. Do you feel like enough African Americans even know about the things that are now available under the ACA that weren't available before? Or, you know, I always like to talk about the things that now you can get done for free in terms of screenings, tests, and things that you used to have to pay for. I mean, it really is set up to broaden access in a dramatic way.
It's certainly, and no. The answer is no. We just have not told that story properly yet, especially with all of the fantastic medium that we have now. 30 years ago, a lot of this didn't exist. You know, our forefathers ran a civil rights movement in this country. When most people didn't have phones in the home. Certainly didn't have email and cell phones and Twitter and Ditter and all that stuff. And sometimes we still fail to get the message out. So that's part of the job. Speaking of getting the message out, at this convention, we will be providing free prostate screening to males that will show up free of charge.
There you go, right? Great example.
Saturday through Tuesday, 10 to 4 at Cobo Center. Any willing person willing to show up to have not only the examination done, but the blood work done that
Right.
will totally be provided free of charge, and we'll be providing the results to them also. Every year that we've conducted these types of screening, we find prostate cancer, a disease that is, if detected early, is totally
curable.
Right,
Right,
curable. That's
right.
right.
Are there other parts of the conference that the public can show up and take part in?
Yes, the first session of the Surgeon General Summit on Saturday morning from 8 to 12 is also open to the public. Our auxiliary, who has been working very hard and is our partner in this convention, they conduct their activities at the same time. They're going to be looking at free sessions on breast cancer and breast health for women. As you know, a disparity again, and this 2015 still existing, is that the incidence of breast cancer in black women is lower than non-black.
Right, but it's more fatal.
But more
to
fatal.
Black women.
Right. So how can you have the incidence lower and the outcomes be worse? There's only one caveat to that, is that females, African-American females on the younger end of the age scale, can have a form of breast cancer called triple negative. And this is something that we're finding more and more, but here again, early detection is the key.
And what is that, triple negative?
Triple negative is a very aggressive type of breast cancer that basically looking at the receptors on the cancer cell and what they respond to are not there, and it's found in a higher incidence in African American
And so
women.
it's more lethal.
It's more fatal, okay?
Yeah.
But here again, early detection is still the key to having better outcomes, even if a woman has triple negative breast cancer. So we're doing some things that we hope will not just educate the public, but educate them to a point that it changes their habits.
It changes behavior. That's still the challenge. Changing behavior, and of course prevention, which is the best way to survive any disease, not to get it.
Right. Stop on red, go on green.
Right. Okay, August 1st through 5th.
August 1st
Cobo
through 5th,
Center.
Cobo Center.
All right.
Great.
Thank you very much for being here.
Thank you for having me.
Good luck on your show,
Right.
which
Thank you.
of course we watch all the time.
Thank you.
Just ahead on American Black Journal, we'll continue our look at health and wellness in the black community. Coming up, a frank discussion about mental illness and substance abuse. Right after this look at some important moments in Detroit's black history.
I'm Ken Coleman with a look back at African American life in Detroit. This week in 1984, the Reverend C.L. Franklin died after he was shot during a burglary attempt at his home. In 1998, Teola Hunter was tapped as running mate for Democratic gubernatorial candidate Larry Owen. And in 1964, Dancing in the Street by Martha and the Vandellas was released. These are significant events this week in Detroit's Black history, taken from the book On This Day, African American Life in Detroit.
When we talk about improving the health and well-being of African Americans, we have to include mental health awareness. Often, there's a stigma about mental illness in the African American community. Next month, the Detroit-Wayne Mental Health Authority is holding a conference to educate the community and religious leaders about mental disorders and substance abuse. My next guest is the Chief Medical Officer at the Detroit-Wayne Mental Health Authority, Dr. Carmen McIntyre. Thanks for being here.
Thank you.
So we were just talking in the previous segment about the difficulties getting African Americans to know what's available for them in terms of general health care, mental health. It's the same thing, and here you're facing an additional hurdle, which is a lot of times people don't want to talk about this.
Absolutely, absolutely. Stigma is a big issue, you know, and stigma meaning it's a mark of weakness, but I think stigma historically having a special significance for African Americans because the archaic term meant a brand.
Right.
And, you know, as slaves, we were branded.
Right.
So I think, you know,
so there's that history.
There's that history there.
Carrying
Absolutely.
forward and making people think twice about wanting to even acknowledge what's going on.
Right.
Yeah.
So, you know, you'd already mentioned earlier the disparities just in general health care. So I think one of the important things is for people to realize that the vast majority of mental illness and substance use disorders are also medical problems.
Yeah, right.
And stop thinking of them as somehow a weakness or, you know, something wrong with you morally.
Right.
They're health problems like diabetes that you should be able to mention and seek treatment for without embarrassment.
That sort of old trope about, well, I'm just depressed or I'm just feeling down and I can get over it, really is not the way to confront these things.
Yes, you're absolutely right about that. And all of us are going to have down times.
Yeah,
you know.
right.
So that's absolutely
But what we're
normal.
talking about is something more profound and again, related to a medical issue that prevents you from being able to live your life normally.
Yes, so that's what, through this conference on August the 19th and 20th, we're hoping to start helping people know when something is maybe more than just the blues, and know when to refer people for help and where to refer them for help.
Where to get it. Let's start about how to identify those things. What are some of the things people ought to look out for as signs that somebody's got a real mental health issue as opposed to just being down?
So a lot of times when people think of mental health issues, they think of, you know, schizophrenia is shown in the movies. You know, something really bizarre.
Popular media does not help with the depiction.
It does not. It does not. But really the most common ones are anxiety disorders and depression. So we all know what anxiety feels like. We all know what having the blues feels like. You know, it's a problem when it starts interfering with your functioning. So it's a sunny day out today. It was easy to get out and get about and get your day started. If it's a rainy day, you know, we drag a little bit, but we still go to work, or we still go to school, or we still cook and clean the house and whatever. So when your symptoms start interfering
when you stop
with getting things done, yes. And that's something people can look out for, a change in the people that, you know, in their family members or the folks that they work with.
Yeah, and then so now let's talk about what you can do. Wayne County now has this mental health authority, which is separate from county government, which is where mental health services used to be housed. How much better is the access now for people in the county?
Well, you know, it's something we continue to work on. The Detroit Wayne Mental Health Authority is going on 2 years old, so we're still relatively new. But we are working on improving access. First of all, access is centralized. So if anybody has questions, you want to know if somebody needs help, you're trying to get yourself or someone else help, it's one number. So 1-800-241-4949. So it's the way just to get information. It's also the suicide hotline. It's also the way to get someone into treatment. So we have that. And then we're really encouraging our providers to do what's called same-day access. So the concept being that it took a lot for me to finally admit that maybe I need help.
Don't make me wait.
Don't make me wait. Don't tell me an appointment's 2 weeks down the line. So really encouraging our clinical providers to say, if I'm ready today, I can walk in today.
In terms of providers, we used to have a pretty extensive state hospital system that's been dismantled over the last 20 years. Some people say that was the wrong choice. Some people say that was the right thing. I think even people who defended the system thought that in those hospitals we were probably not doing the best job that we could. How different does that look now? What's taken the place of those state hospitals, and is it enough to treat the population?
Right. You know, there was a somewhat controversial paper written recently by Dominic Sisti and others talking about the return to the asylum. And we certainly at the Detroit Wayne Mental Health Authority don't advocate the typical idea of an asylum. But there is a recognition.
So this was a paper recommending that we bring back that
Well, the thought was that maybe we went a little too far in emphasizing community treatment, and that there are some people that really need long-term treatment. So at the authority, we're following the example of the Centers for Medicaid and Medicare Services that says we really need to focus on community integration. And in the Community Mental Health Act, which was actually JFK's last signed legislation, that emphasis was there. So we're talking about from the 60s. We're not talking about a new concept, but something we've never actually realized. So yes, let's get people out of a hospital setting, but what's the alternative in the community?
How do they get services if they're not in that setting?
And it's not to go to segregated, you know, mental health and substance abuse sort of treatment facilities that are out in, you know, the burbs somewhere where you don't see
isolated.
them. Isolated, absolutely. So we really want to have people get their treatment in the same communities where they expect to, you know, live, work, and play. So, you know, yes, hospitals are necessary for some folks when there's acutely a danger to themselves or others. Sometimes some folks need longer term care, And it could be in a residential setting in the community.
Yeah.
The problem we have right now is that in Michigan, licensing says that you can't lock those units.
Right.
So when you have someone who doesn't understand the need for treatment or is that confused that they might wander away from treatment, we end up keeping them in state hospitals for a long time. It'd be great if we could have them in the community where they want to be, where their families are, you know, just be able to keep them in that facility.
So is that a legislative challenge?
That's a legislative
challenge.
Just
a rulemaking. So we've got to get the legislature to think about that.
100%.
Yeah. Let's talk about the Affordable Care Act and how that has changed access to mental health services, and particularly in the African American community. In the previous segment, we talked about how many African Americans now get access to insurance that they didn't have before.
Right.
There's got to be some ripple effect in mental health too, I would imagine.
Sure, absolutely. So we know that it seems like by and large the racial disparities in healthcare probably fall into three things. Genetics is one, but genetics is not all of it or even most of it.
Right.
Then there's the access because of poverty and whatnot. And then there's cultural issues and education. So the genetics for things like schizophrenia, that's going to be the same across any race.
Right.
Depression and anxiety disorders, however, when you're in an unsafe neighborhood, you don't have enough resources to live.
That surround Black people's lives.
So that's absolutely going to increase things. So we know that access to health care through the Affordable Health Care Act has gotten a lot more people insurance.
Yeah.
And we do have to applaud our current administration here in Michigan at getting the Healthy Michigan expansion to Medicaid, where a lot of other states didn't pursue it. So we have found a lot more people have that access. The trick is they have the access, but we haven't maybe done the best job at advertising who we are, how to get our services.
Yeah.
So that's what we're trying to do by our collaborations with faith leaders and churches, with primary care organizations, and trying to get out just to regular stuff like ethnic festivals and whatnot. Let people know we're there.
Yeah, yeah. How can people participate in the clinics, the conferences that you're having in August?
So August 19th and 20th, it's our Faith and Mental Health and Substance Use Disorders Conference. So it's our first annual. We hope to make this the first of many.
Right.
And the 19th, we're really trying to target for faith leaders, okay? But the 20th is open to all.
It's open to the public.
And both days are free. It's being supported by a grant from the Michigan Department of Health and Human Services. And a great thing that we did in the last fiscal year was integrate substance use disorders with the rest of behavioral health.
Oh, very good.
You know, because there's huge overlap. No reason to treat them separately. So folks can participate on either day. It's at general public on the 20th. It's at the University of Michigan Dearborn campus.
Okay.
Free.
Yeah.
Come on board, hear things like the importance of spirituality, but when prayer might not be enough.
Right, right, when you need help. Okay. Dr. McIntyre, thank you for being here.
Thanks for having me.
Yes. Today, finally, there is a new way for Detroit area kids to stay fit while learning more about the great Michigan outdoors. The State Department of Natural Resources just opened a new outdoor adventure center on the Detroit riverfront in the historic Globe building. In addition to providing an educational experience, the center shows children how much fun it is to play outside.
Well, the Outdoor Adventure Center opening is really great. Detroit's making a strong comeback. Midtown, downtown's doing great. This is just another element of that.
I think that for the children of Detroit who may not be able to travel far, we can give the taste of what up north is and what fun it is to play outside. And once we play here, the next time they visit, we'll go outside. And then from there, we'll go to Belle Isle. What we'll continue to do is get people excited, inspired, and confident users of the outdoors. And we hope that starts here.
What we really need to do is garden the next group of conservationists in this state. So how do you get the next generation involved? And the Outdoor Adventure Center will allow them to be citizen scientists and understand their direct role in the preservation and promotion of Michigan's great natural resources.
I was actually here to announce the kickoff of this project, and this building was an empty shell. It was terrible. To see it today is absolutely incredible. The exhibits, the activities, the opportunities for everyone to learn more about the outdoors by coming here is wonderful.
If you get kids experiencing the outdoors, getting their hands dirty, and then making something, and understanding how they're part of a bigger picture, that actually will bode well in their future careers and their future quality of life.
The most exciting thing about finally being opening the building to the public, is that we get to see the building and the exhibits and the experiences we put in the building through other people's eyes, through little kids and grandmas and grandpas, and we get to see their excitement and their wonder. That's the gift, and we can't wait to see that happen over and over again.
Detroit is a comeback city, along with Michigan being the comeback state. This is another step in its evolution, and I'm proud of the role the state is playing. We've had Milliken State Park for a long time. We recently did Belle Isle as a state park. Now we've got the Outdoor Activity Center. So while we're still trying to help on economic issues and doing well there, now we're also helping on quality of life issues and creating a brighter future for particularly the kids of Detroit.
We want to thank the state of Michigan for that video. The Outdoor Adventure Center is open Wednesdays through Sundays. That's our program for today. Thanks for watching. You can get more information about our guests at AmericanBlackJournal.org. And as always, connect with us on Facebook and on Twitter. Plus, you can now hear our program on WDET 1019 FM. We'll see you next time.
At DTE Energy, we believe that we have a greater responsibility. We believe that being part of a community means being involved in the fabric of that community, investing time, effort, and resources in the communities we serve. DTE Energy Foundation is a proud sponsor of American Black Journal.